Good afternoon, everyone. Today, my presentation its topic is management of some simple malocclusion. So, what are the objectives of this? We have to define first occlusion, class 1 occlusion, class 1 malocclusion, then line of occlusion, then different types of the class 1 malocclusion, Bimax protrusion, some features, diagnosis, and treatment plan. So, now start with the management of some class 1 malocclusions. So, which is mainly aimed to correct the crowding, spacing, open bite, cross bite, deep bite, rotation, and bimaxillary protrusion. Now, you can see in the picture, there is a crowding in the lower anterior teeth. So, what is the definition of crowding? It is defined as the malalignment which is caused by inadequate space into the arch. So it is mainly occur due to genetic and environmental factor. So it is classified into three. There is a mild crowding, moderate crowding, and severe crowding. Mild is less than 4 millimeter per arch. Moderate is 5 to 9 millimeter per arch, and severe crowding is 10 millimeter. So before carrying out any treatment, the following aspects should be considered. The degree of crowding, site and position of crowding, and patient's age. So you can see in the figure, there is mild crowding. So it's a 3 to 5 millimeter. So we can treat the patients with the proximal stripping. Sometimes if patient comes in the younger age, we can align the teeth by using the removable appliances. If you see moderate crowding, there are another treatment option. There is an expansion of the arches. You can see the figure. There is expansion of arch with the quad helix and the distalization of the molar. So we can get space with the expansion and distalization of the molar. But before deciding any treatment option, first we need to check about the patient's profile. That is very, very, very important. Now comes to the severe crowding. In severe crowded case, usually there is requirement of the extraction of the first premolar. So we need to retract the canine by canine retractor. We need to align the anterior. Sometimes we require micro implant also. And in this type of the patient, there is a Hollis retainers are required. Now comes to the class 1 malocclusion with the spacing. It may be localized like midline diastema and it may be generalized. What is spacing? It's a gap between the tooth teeth and the mandible teeth. So it can be localized means in the localized area and it can be generalized. In generalized cases, it usually results from the hypodontia along with the microdontia in well-developed arch and sometimes it's maybe due to enlarged tongue. In case of microdontia, we need to eliminate the space between the anteriors, leaving the space between canine and first premolar. Even it give sometimes its requirement of the prosthesis and implant also. In case of the localized spacing, it may be due to loss of tooth due to trauma, hypodontia, or midline diastema. So intervention is only required when the patient has diastema greater than 3 millimeter and there is no space for any permanent or lateral incisor to erupt. So we need to close the space either using removable appliance. If there is a high labial frenum, we need to cut the labial frenum and we can give the stabilized result. Now comes to the intervention. In that we need to eliminate the high labial frenum attachment. Now removable appliances which is commonly sometimes we can treat with the finger spring with labial bow and the split labial bow. In high frenal attachment, the frenectomy is required. Then fixed appliances we can use. There is a pin and tube, edgewise, all the appliances with the fixed orthodontic treatment we can treat the patient. Now comes with the crossbite. What is crossbite? It is a condition where one or more teeth may be abnormally positioned buccally or lingually with reference to the opposing tooth or teeth. You can see the maxillary molar is inside and mandibular molar is outside. So it is crossing the arch, so it's a crossbite. There are different types of crossbite. There is anterior crossbite and posterior crossbite. In anterior crossbite, there is a single tooth or multiple teeth. In posterior crossbite, it's a single tooth, unilateral or bilateral. So how can we manage the crossbite? Anterior crossbite, we can, if patient comes with us in the growing age, we can use tooth Z spring. In multiple teeth, we can use expansion screw, which is removable one if patient comes with us in the growing age. Now, posterior crossbite, if there is a single tooth, we can use a cross elastic. You can see in this figure, we have engaged elastic from buccal hood to lingual button. Now comes to the unilateral crossbite. When there is unilateral crossbite, patient comes with the growing age, we can use the expansion appliance like quad helix, W arch and coffin spring. This is a quad helix, coffin spring and W arch. These are the normal removable appliances normal expansion appliances which we use. Now this is a bilateral crossbite. Same appliances, one another more is RME with the high red screw, which is a rapid maxillary expansion appliance we use, and it gives a very nice result in the expansion and the correction of the crossbite. Now comes with the open bite. Open bite means there is failure of a tooth or teeth to meet their antagonist in the opposing arch. So there is development of the open bite. It is often associated with some habits. It may not be. So there are the types of open bite in which there is simple anterior open bite and simple posterior open bite and complex or skeletal open bite. So how will you manage the open bite? In open bite management, we can correct the simple anterior open bite, whether it may be developed with habits. For example, digit sucking in the mixed dentition. So we have to stop the habit first. So habit breaking appliance we use, that is a tongue spike, arch expansion appliances. If the patient comes in the late mixed dentition period and early permanent dentition period, we should first use habit breaking appliance. Even simple posterior open bite, it may be due to lateral contrasting, ankylosed primary molar. This is happen. So removal of ankylosed tooth and allow the eruption of the permanent teeth. This is a solution of that. Then complex open bite, in those type of patients, there is a vertical problem. So if patient comes in the growing age, so we need to treat with the bionative frontal appliance with the myoconchal appliance. And in adult cerebral open bite, orthodontic surgery is required. Now comes with the deep bite. Deep bite, there is a excessive overbite. It is a condition of excessive overbite where the vertical measurement between maxillary and mandibular incisor margin is excessive when the mandible is brought to the centric occlusion. You can see in the figure, maxillary incisors are totally covered the mandibular one, and there is a traumatic bite also. So if patient comes in the growing age with the deep bite, we can use the anterior bite plate. You can see in the figure there is an anterior bite and this is a removable plate which we can use. It can intrude the lower incisor. Even we can use the fixed appliances with the J-hook headgear. It's a high pull headgear, this photo, and which correct the intrusion of the teeth and allow the posterior teeth to erupt. If the patient comes with a non-growing, then orthodontic surgery is the only option in which Lipot 1 osteotomy is required. Now, last one is the class 1 bimaxillary protrusion, in which maxillary and mandibular teeth are protruded. In this type of patient, extraction is usually preferred if there is no spacing and we require space to correct the proclination of the anterior teeth. So we do first premolar extraction, then retract the incisors and we can correct the patient face. Sometimes it depends on the angulation of the canine, which is distally inclined canine. So first we need to retract the canine, then align incisor using details. Now you can see the rotation. There are so many chances of development of rotation due to lack of space. There is a single tooth rotation, so we can use the removable appliances like double cantilever spring, labial bow. Sometimes T-spring can be used, but there is multiple rotation. We need to use fixed appliances. We need to do couple of forces. So these are the different type of the minor occlusions in which there is a cross bite, rotation correction, class 1 bimaxillary protrusion. This all require the orthodontic treatment very precisely and